Good afternoon, everyone. I'm Mirjam Nalupe. I am a PhD candidate registered with the University of Johannesburg. I would like to acknowledge my supervisor, Prof. Charlene Downing, who is in the audience, from the Department of Nursing, Faculty of Health Sciences, University of Johannesburg. I would like to present an abstract based on the phase 1 of my study, which is the experiences of HIV serostatus disclosure among young women living with perinatally acquired HIV at the Intermediate Hospital Katutura ART Clinic, Windhoek, Namibia. So, introduction and background. According to UNAIDS data, about 1.7 million adolescents and young people are living with HIV, and 80% of them are found from sub-Saharan Africa. HIV self-disclosure remains one of the key components in improving adherence to antiretroviral therapy and preventing secondary HIV transmission. Young women with perinatally acquired HIV do not only have to know their HIV status, but also face myriad challenges with disclosing their status to peers, family members, and intimate partners. In Namibia, as in other countries, especially in sub-Saharan Africa, young women living with HIV face numerous health and psychosocial challenges which could potentially affect the country's progress towards the UNAIDS 95-95-95 targets by 2030. So the study aim was to understand young women living with perinatally acquired HIV's experiences on HIV serostatus disclosure to family members, peers, and sexual partners, and develop strategies for professional nurses to facilitate HIV self-disclosure and enable them to make informed decisions about when and to whom they disclose. The study design and methods. The study was conducted, as I said earlier, at Intermediate Hospital Katutura ART Clinic in Windhoek, Namibia, between 2022 September and May 2023. A qualitative, exploratory, descriptive, contextual research design with a phenomenological approach was used. A purposeful sample of 18 young women living with HIV, with perinatally acquired HIV aged 18 to 22, were interviewed through in-depth interviews. Data was collected through audio tape, transcribed verbatim, and supported by fieldwork notes. Measures to ensure trustworthiness and as proposed by Guba and Lincoln, and ethical considerations were adhered to. And the findings were summarized into 4 themes using the Brown and Clark method of data analysis. So the first theme was that participants experienced unawareness of their HIV and status and had to take medication without knowing why, and any understanding of the infection. So under that theme, there were 3 categories that young people, especially the young women, they have experienced prolonged time before they knew their HIV status, and some of them had to find it out by themselves through the health passports as they go to the hospitals alone, or through attending teen clubs, which are peer groups that are for young people living with HIV. So theme 2 was that participants demonstrated resilience and acceptance of their HIV status despite various challenges. 3 sub-themes were generated from this theme. One was that young people were resilient. They demonstrated resilience despite the various challenges that they've encountered in life. And then they have also found that teen clubs were supportive, and they have found an acceptance of their HIV status through attending teen clubs. So participants, the third theme was that participants are hesitant to disclose due to a lack of trust and fear of facing discrimination and stigma. So very few of them have disclosed to others. Most of them have only disclosed to a limited selected number of family members or close friends. And those that have not disclosed, they have indicated that they actually fear to be discriminated. And also some of the participants indicated that their parents and caregivers have actually discouraged them to disclose for fear of discrimination, stigma and discrimination. Theme 4, participants need guidance, indicated that they need guidance and support on how to disclose their HIV status to significant others. And 3 themes actually came out of, 3 categories, sorry, came out of this theme. One was that they've indicated that healthcare workers, most of them are friendly as they encounter them. However, there were some negative treatment that they received from the healthcare providers, and they would actually suggest that healthcare workers treat them and support them with empathy and prepare them for self-disclosure. They have also indicated that there is a need for collaboration between the health care team and the Ministry of Education, specifically the teachers, to incorporate or revise the curriculum, because they feel that their peers do not know much about HIV, and as such, it actually makes them not comfortable disclosing to them, either as friends or of intimate partners, because the understanding is not there for the basic facts about HIV. They also called for community health education to actually sensitize the community, because they feel like there's a gap between what the community knows and what is really the facts of HIV. So the way forward, as I've presented to you, phase 1. Phase 2 is the development of a conceptual framework through finding patterns in collected data and draw conclusions about participants' experiences of HIV disclosure. Phase 3 is the development of strategies for professional nurses to facilitate and support HIV self-disclosure among young women living with HIV to become confident and disclose with ease and be resilient when faced with negative outcomes of serostatus disclosure. Phase 4, which is the last phase, is the evaluation of the developed strategies by a panel of experts in the field of young people and HIV using an online Delphi technique. Thank you for your attention, and thank you for listening. Thank you.